Good afternoon, everyone. My name is Albany Penn. I am a doctoral student from the School of Public Health at Florida International University, and I'll be sharing my findings from a systematized review aimed at understanding resilience and stress in healthcare professionals post-cyclonic natural disasters. So climate change has been a topic of concern in the Caribbean for some time. We've seen an increase in natural weather events that have become more frequent and more intense. And given our position geographically, the Caribbean is constantly being exposed, especially when it comes to hurricane events. For example, Hurricane Maria, Irma, and Hurricane Dorian were all devastating storms. And with these disaster events, the topic of mental health has come to the forefront. There are two major outcomes related to disaster trauma which may occur. The first being PTSD, which is a psychiatric disorder exhibiting negative stress responses. First responders and healthcare workers are more likely to develop PTSD because of their line of work, making them more susceptible to psychological morbidity. The other outcome is post-traumatic growth and resilience, where survivors of traumatic events show positive change and display the ability to overcome hardships and adversity. The aim of this review then was to explore and provide a summary of experiences of healthcare professional first responders after hurricane disasters in the context of Latin America and the Caribbean region. A literature search was conducted using multidisciplinary search engines, including PubMed, PsycArticles, Sanal, and others. The keywords were predetermined and used to locate relevant articles. Additional studies were also found by manually searching the reference list of the articles that were located. Studies that were included were expected to investigate risk factors of PTSD, post-traumatic stress, and resilience amongst health professionals, nurses, physicians, and EMTs after hurricane disaster. In total, there were 21 articles included based on the abstracts. After additional eligibility screening by 2 reviewers, 11 publications were included for final review and analysis. Generally, the findings related to PTSD amongst healthcare professional first responders show that the group is still high risk. Regarding factors that potentially influence the outcome of PTSD, most challengers reported occupational issues like lack of organization, a large workload requiring staff to multitask duties. Insufficient training was also listed, along with concerns about post-disaster job security and poor workplace communication. Also, the nature of the work performed and the exposure to negative media coverage put them at higher risk of developing adverse psychological effects. Resilience within the health professional domain also included strong themes of communication, participation, workplace structure, roles, and responsibilities. Teamwork was also emphasized to establish good working relationships and fostering resilience. Pre-disaster training and a person's competence and knowledge of their job were found to reduce distress. From the results, we can conclude that PTSD and resilience are closely related, where the characteristics of resilience facilitate the ability to manage traumatic events more efficiently. Therefore, improving factors related to resilience will most likely reduce the outcomes of PTSD and make persons less susceptible to adverse mental health risk. Limitations for the review are related to the limited research results found in the context of the Americas. It was also difficult to compare study findings since outcome strategies and tools vary differently amongst the studies. Finally, given the vulnerabilities of climate change facing small island developing states like the Caribbean, it is necessary that literature findings such as this be considered for primary research in the future or policy discussions on hurricane disaster preparedness.